Well, February is Heart Health Awareness Month, and right now it is more important than ever to keep track of your body's physical health, including your heart. And joining us now to talk about how you can make heart health a priority is Dr. Sabrina Fabi. Dr. Fabi, as always, thank you for joining us.
Thank you so much for having me.
So let's talk about some of the factors that are putting people, specifically younger adults, at risk for heart disease.
So half of all Americans have one of the top 3 risk factors for heart disease, which include high blood pressure, having high cholesterol, and believe it or not, smoking. And we still have over 34 million Americans smoking, if you can believe it.
Well, is gender a factor? Are men more likely to develop heart disease than women? And are there differences in the symptoms and the diagnoses?
Yeah, so heart disease ends up killing 1 in 5 women. It's the #1 cause of death in women as much as it is in men, but they present quite differently. And there have been some recent studies to show that there is not as many aggressive procedures done on women when they start having symptoms because their symptoms are so different. So historically, we have always heard if you have chest pain, then you are having a heart attack. And that is a very common common symptom. But what we find is that in women, more atypical symptoms usually develop, such as nausea or abdominal pain or even shoulder pain. And because of this, they can have delayed diagnosis of their heart disease and not have more invasive procedures like stents placed because they are not ruled out as having heart disease, and they end up actually dying from this.
So what can we do? Are there also differences in how they medicate them for or prescribe medications for men and women? That's obviously a concern if women are obviously dying more from it and not, showing symptoms typically. I mean, what can we do?
You're right. So in a recent study that was actually published by the Journal of American Heart Association, they looked at over 43 different sites that were giving out, primary care sites that were giving out cardiovascular medications. And what they found was that men were more commonly treated with the most common medications that we give, like high blood pressure medications, statins, which decrease cholesterol, as well as aspirin. And women more significantly of the time did not get these medications prescribed to them. And so again, is it because they are not complaining of the classic symptoms like men are, or is it because they are just not coming in more? They don't think that they should be coming in for this. And so just like women go in to get their breast exam and their mammograms after the age of 40, they really need to be going in to their primary care doctors regularly to be examined for their heart health.
So really, I guess bottom line, what can we all do to protect our hearts against heart disease?
It all comes down to prevention. So the #1 thing is minimizing stress. We know that high cortisol levels put our system in a hyperinflammatory state, which participates in closing those vessels down and possibly increases our risk for heart disease. So things like yoga and meditation have been found to bring down those cortisol levels. Smoking is an easy one. Stop smoking, because that also causes inflammation in our blood vessels that end up clogging them up and adding to the risk of heart disease. And then obviously diet. What we know is that a diet that's low in sodium can participate in decreasing our risk of heart disease. One that is high in magnesium, which can be found in a lot of vegetables, has been found to decrease the risk of cardiovascular disease by at least 7%, especially in women. Women need to know that their risk increases 1 in 3 after they go into menopause for heart disease. So it becomes much higher once going into menopause. So that's something that you should even be more mindful about. And the last thing is being outside and getting a lot of pollution. San Diego is one of the largest, or out of all of the cities, 1 in 6. So it's a top 6 in pollution. And what we know is that pollutants, particulate matter in pollution, has been found to increase the risk of heart disease. After 2 hours of being exposed to pollution, we start to see respiratory distress from that pollution. So if you are running and doing your exercise outside, try to keep it at a minimum, try to keep it in a park far away from a highway.
So obviously healthy lifestyle and of course prevention is the key. Dr. Fabi, always a pleasure to see you. Thank you for joining us and breaking that down for us.
So lovely to see you, Maria.
All right, thank you.